Hey, I want to talk to you about 5 things about ACE inhibitors that you need to know. ACE inhibitors are commonly used in people with high blood pressure, and they are things that end in the suffix pril. So captopril, enalapril, lisinopril, benazepril. Those are the common ones that are being utilized. So let's talk about these 5 things you need to know about. Number 1, they are proven to increase the risk of viral pneumonia. That is according to studies, and I think that's why a lot of people suffered during the recent events of the last few years because they were on ACE inhibitors, and one of the comorbidities was hypertension. Number 2, ACE inhibitors can cause a cough. Very, very common, much more common than what's reported in the literature as far as my practice is concerned. Number 3, they can cause your potassium levels to go too high, so be very careful with that. Now, most people suffer from low potassium, especially on the measurements of intracellular that I check, but again, check your potassium levels and see what they're at on ACE inhibitors. Number 4, they can cause kidney issues, so you need to be aware of that. A lot of times they're said to preserve your kidneys, but they can also cause kidney problems. And number 5, they can cause a dangerous condition called angioedema, so be careful of that. And people that may have that particular sensitivity, this allergic response, can lead to airway compromise and even death. So it does happen. It's not obviously very common. So those are 5 things. The most important thing you need to know about ACE inhibitors is that they are a cover-up. They're a Band-Aid. They do not address the cause of the problem. If you've got high blood pressure, you need to figure out why. You're not deficient in ACE inhibitors. You are deficient in many other things, different vitamins, minerals, nutrients, foods, healthy lifestyle, and you have an excess of environmental toxins and other pollutants such as pharmaceuticals. So that's my 5 different things you need to know about ACE inhibitors.